Good morning, everyone. I'm Kevin Galetz, and I'm an Industry Education Coordinator working with the Regina District Industry Education Council and SunWest School Division. Today it's my pleasure to introduce Christina McFall, who is a clinical consultant pharmacist working for Rubicon Pharmacies. Christina is a graduate of Rochetown Central High School and a graduate of the Bachelor of Science in Pharmacy program at the U of S. She will tell us what a clinical consultant pharmacist does and discuss her career path to this position. Just a reminder before we begin, this session is being recorded and will appear on the RDIEC YouTube channel for you or others to view in the future. We'd also like to request any students who watch this session to go to our website at www.rdiec.ca and complete the student survey that can be found near the top of the web page. Completion of the survey gets your name in a monthly draw for a $50 gift card. Again, the website is www.rdiec.ca. Welcome, Christina. I'll let you take it from here.
Thanks. So like Kevin said, my name is Christina McFall, and I am going to be doing the Career Spotlight presentation on a pharmacist today. So a little bit about myself. I currently work as a clinical consultant pharmacist at Rubicon Health Solutions in Regina. I've been a pharmacist for about 4 years now. And prior to coming to Regina, I worked in a community pharmacy in a small town for about 2 years. And I'll get a little bit more into my role as a clinical consultant pharmacist in a few of the later slides here. But first, I just want to go over what a pharmacist does. So when most of you think about a pharmacist, I'm sure a lot of you picture someone in a white coat standing behind a pharmacy counter counting pills all day. To be honest, that's what I pictured that pharmacists did when I was exploring career options. I thought that the job looked kind of boring. I didn't really want to count pills all day and just stand there. And it wasn't until I did my own research that I found out that pharmacists do a lot more than just count pills. In my job right now, it's actually very rare if I'm counting pills. So I think the perception of what pharmacists do in the public eye is a little bit different. And pharmacists' role is constantly expanding, and our responsibilities are constantly changing and growing. So I'm going to talk to you about some of the job description and duties of pharmacists. So we dispense prescriptions. So this would be the process of receiving a prescription from a prescriber, filling the medication, preparing the medication, and dispensing it to the patient. So throughout this process, we're ensuring patient safety. So we're checking for any medication allergies. We're checking for any drug interactions, making sure that the patient is receiving the right dose, that they're receiving the right medication for the right diagnosis. And then once all of that has been done and the medication is deemed safe to administer to the patient, then you would counsel and educate the patient on their new medication. So for someone being started on a new medication, they might not know how to take the medication. So you would explain to them how to take it, what to expect from the medication, how it works, any side effects that they might experience. You would go over all of that with them. If someone was being started on a new device, like a nose spray or an inhaler, maybe someone who just got recently diagnosed with diabetes is being prescribed a new insulin pen and they're having to give themselves injections now. We go over all of that with the patient, make sure they understand how to properly administer the medication to themselves, and that they know how to properly use a certain device, and just make sure that they don't have any questions or concerns, and that you feel comfortable them leaving your pharmacy and being able to administer that medication safely. Another thing that we do usually on a daily basis is communicate with prescribers and other healthcare professionals. So a lot of times when we get prescriptions from doctors, we might need to contact them maybe regarding a dose of a medication, maybe depending on the person's kidney function, they need a decreased dose. We are constantly in talks with doctors about clarification regarding prescriptions or anything that may need to be changed. We also, sorry, we also talk with other healthcare professionals, especially in my role that I'm in now. We provide medications to a lot of care homes. So we are in constant talks with care home staff, other nursing home staff. A lot of nurses contact us for medication questions or clarifications. We might contact nurses regarding the health status of patients. So communication is definitely a big one. We deal with insurance companies. So this isn't usually something that's learned in school. I would say this is more so learned on the job. A lot of times we're calling into the Saskatchewan drug plan, trying to get someone drug coverage. We always want to make sure that someone is paying the least amount for their medications. We'll make sure that people are on certain medications that meet certain criteria in order to get coverage. So this is usually always going on behind the scenes. We also administer injections. So the most common one would probably be the flu shots. So this is something that becomes a day-to-day activity, especially during the flu season. We become quite busy with flu shots. We also administer other injections as well. We can administer other travel vaccines. We can administer antipsychotic injections, contraceptive injections. We can administer a lot of different ones, but I would say the most common one is the flu shot. There is talks that we will be administering the COVID vaccine coming up in the next couple of months too. So that will be something that will become a large part of our day-to-day duties. We can provide medication reviews. So this would be the process of sitting down with a patient one-on-one or with a caregiver and going through all of their medications, checking to make sure that each medication has an appropriate indication, looking at their medical diagnoses, answering any questions or concerns that the patient might have. We would look up their lab work to see if everything looks good. And then if any issues arise throughout that, we would then contact their doctor. Usually we write up a recommendation letter to their doctor, just summarizing what we've discussed with the patient and if anything needs to be changed dosing wise, or maybe a medication that someone's on they might not need to be on anymore. We have any recommendations that we found to the doctor at that point. And we also prescribe minor ailments. So these would be for things that would save you a trip to your doctor. So pharmacists can prescribe for urinary tract infections. We can prescribe for acne, diaper rash, shingles, contraception. I think there's about 27 minor ailments now that pharmacists are able to prescribe for. So these would be things that instead of finding the time to book a doctor's appointment, you could actually go into a pharmacy and speak with a pharmacist right away and see if there's anything that they can do for you. So this definitely helps out a lot of patients in that aspect. Some skills and traits that would be good for someone interested in a career in pharmacy would be good communication skills. So like I mentioned before, you're constantly communicating with other healthcare professionals, you're communicating with patients, so whether that be over the phone or at the counter, and you're also communicating with your other coworkers and your pharmacy team on a daily basis. So having good communication skills is definitely important. Having good attention to detail is really important. You're dealing with people's health and medications, so making sure that you're paying attention to the right dosing of medications, that you're dispensing the right medication, that's very important. Having empathy is important. So A lot of times people come to you in a vulnerable state. They maybe just received a scary diagnosis, and there's a lot of questions and unknowns that this person may have. So being able to put yourself in their shoes and be able to take the time to answer any questions they may have, and just develop that relationship and let them know that you are there for them. And if they have any questions, they can always come to you. We always don't know what's going on in people's personal lives, so being able to be patient and just take the time to be empathetic towards individuals is really important. And then being kind. So this is kind of self-explanatory. Obviously, if you're kind to individuals and kind to your patients, they will want to continue to come back and see you, and they will feel comfortable asking you questions and coming to you with any concerns. So some different types of pharmacies. So the most common one would be a community pharmacy. So this would be something like a Pharmacies, London Drugs, a Shoppers Drug Mart, a Rexall pharmacy. A lot of these are found basically on every street corner. A lot of them are in grocery stores or in shopping malls. So these pharmacies, if you walk into, they usually have a front store section. So they would have aisles of medication that you can just buy without speaking to a pharmacist. So if you needed some Advil or some cough syrup, they also would have a pharmacist there behind the counter, and where you could get medications that would be prescribed. Another type of pharmacy is a hospital pharmacy. So these are pharmacies located within hospitals. So they provide medications to the patients admitted within the hospital. And the pharmacist here would work collaboratively with other healthcare professionals throughout the hospital to make sure that they're getting the best health outcome for the patient. There's compounding pharmacies. So these are sometimes similar to a community pharmacy, but they specialize in making custom formulations of medications. So these would be in order to meet specific needs of patients. So if there was a child who couldn't swallow pills or capsules and the medication wasn't available in a liquid form, a compounding pharmacy would take those pills and make them into a liquid form. So they basically look at the needs of the patients and find a way to make that drug into a formulation that fits the needs of that patient. And then there's clinical pharmacies. So this would be like the pharmacy I work in. So what makes us most different from a community pharmacy would be that we don't have a front store. So when you walk into our pharmacy, we look more of like an office setting. So you can't come in and browse the aisles and shop for cough syrup or Advil. We basically have a reception area and then some desks, and we do have, we refer to them as robots, but it's basically technology in the back part of our pharmacy that actually packages medications in blister packs that we administer to our patients. So we mostly supply medications to special care homes throughout Regina. We do have individual clients as well, but anyone can come to our pharmacy, but the most common of our patients is patients in care homes. We're more of an outreach pharmacy, so we deliver our medications, we go to a lot of our care homes, and we really focus on those clinical services. So for example, I go out to one of my care homes once a week. I meet with the doctor and the nursing staff and the patient, and we basically work collaboratively as a team to come up with the best possible approach for the patient. We also go to some of our care homes and we put on presentations. So this might be for the patients in the care homes or for the care home staff. We have a bunch of different topics that we can present on. We go out and do clinics, so we do some blood pressure clinics and some diabetes clinics. We really focus on providing a lot of medication reviews. We provide smoking cessation. We basically make sure that we're interacting with their care homes and we're developing those relationships with our patients, and just really focusing on a lot of those clinical services that are going to ultimately get the best possible health outcome for the patient. There also are different types of pharmacies that someone could work in that are less common than the ones mentioned here. You could be a military pharmacist, you could be a research pharmacist. There are pharmacists that work for the drug plan, there's pharmacists that work at the university, you could be a university professor. There's a lot of different areas that you could work in as a pharmacist. So the possibilities are a lot. So some rewards of being a pharmacist. So you get to develop relationships with patients. So for me, this is really important, especially when I was working in a small town. You basically know everyone in town, and being able to just know them on a personal level, and they trust you with their medication and they trust you with their questions. They come back to you every month needing their refills. And just being able to interact with them on a personal level is a big reward. A lot of times you get to see patients kind of in their ups and downs. You get to see them when they're sick, when they're healthy. So being able to develop that relationship is really important. You get to improve patient outcomes. So for me, this is something that makes me feel really good, knowing that I'm making a difference for someone. Maybe someone comes to you 1 month and they're experiencing some side effects from one of their medications. They express their concerns to you. You might look at their medications and decide that maybe their dose could be decreased. So you might reach out to their doctor, see if that's something that the doctor agrees on to decrease that medication, and then the patient goes on the decreased dose. Maybe they come back to you in a month feeling much better, and usually the patient is so thankful that you were able to take the time to address their concerns, to reach out to their doctor. You've made a difference in their quality of life, and that's definitely a huge reward. There's a diversity of career options. So like I mentioned in the slide prior, there's a lot of different areas you can work in. You can specialize in some different areas. So there are a lot of options. There's continuous growth and learning. So there's always new medications coming onto the market. There's always changing guidelines with medications. We were told recently that we would be administering the COVID vaccine. So for us, that was a lot of learning, you know, how is this going to fit into our day-to-day work? How do we administer these vaccines? So there's always things that are coming up, and you're always growing and learning throughout your career. You have job satisfaction. So this kind of ties into what I had mentioned before about developing those relationships and improving patient outcomes. Knowing that you're making a difference gives you job satisfaction. You're a trusted and accessible healthcare professional. So people come to you and with their medication questions and concerns, and they really trust your opinion. And there's a good life-work balance. So for me, this is something that's really important. As a pharmacist, I can't really bring my work home with me. I can't fill prescriptions from home, and I can't counsel patients at home. So being able to keep those two separate is something that's important to me in achieving that good life-work balance. Some challenges of being a pharmacist. So sometimes you might work in a busy pharmacy. So a lot of times there might be a lineup of people standing at your pharmacy counter. Maybe they're angry because they're waiting too long for their prescription. The phones may be ringing and there's people out in the aisles that need your help. Working in a busy pharmacy could become stressful. You could work long hours. So depending on the workplace, a lot of pharmacies are open evenings and weekends. It's typically not a Monday to Friday 9 to 5 job. So depending on your lifestyle and flexibility, this would maybe be a challenge for you. And there's no room for error. So obviously working with medications, working with specific dosing, you always have to come to work with a clear mind and avoid distractions in order to make sure that you're not, in order to ensure that you're minimizing the risk of error. So salary and benefits of a pharmacist. So the salary range would probably be from around 75,000 to 120,000. So this would depend on your experience as a pharmacist, your experience within a company, and how long you have worked there, or how long you've been a pharmacist for. And as for benefits, so these would be like health and dental benefits. Most companies would have benefits, and most companies would usually have a pension plan as well. So educational requirements in order to become a pharmacist. So you would need your high school education. Some of the main classes for that would be math, biology, chemistry. And then there are 10 universities across Canada that offer a pharmacy program. So like Kevin mentioned, I did my schooling in Saskatoon at the University of Saskatchewan. But there is a pharmacy school in all of the provinces. So in order to become a pharmacist, you need to get your Doctor of Pharmacy. So this has changed since I graduated university in 2017. I graduated with a Bachelor of Science in Pharmacy. So the program has since changed a little bit. So it is currently a Doctor of Pharmacy. So it's a 4-year degree. And you need 2 years of university level studies prior to the program. Which means you could complete your pharmacy education in a minimum of 6 years of university. So some pre-pharmacy classes would include biology, chemistry, physiology, math, nutrition, microbiology. You would also have elective classes that you would take as well. And then once you get accepted into the pharmacy program, the classes would obviously be tailored more towards pharmacy. And then throughout your schooling, you would have work experience and work placements where you get hands-on experience using pharmacy skills. So licensing, so in order to work as a pharmacist, you need to be licensed. So you need to pass the Pharmacy Examining Board of Canada. So this is a national exam that all students would take after they have completed their university schooling. And then once you have passed the Pharmacy Examining Board and have received your license, you can then work as a licensed pharmacist in Canada. There are also advanced certifications for pharmacists. So these are areas where you could take extra training and you can specialize in things like geriatrics, pediatrics, oncology, psychiatry, asthma. You could become a pain educator. You could become a diabetes educator. There's a lot of different options for advancements if you were interested in kind of working in a more specialized area, or if there was an area that was of an interest to you. So there are a lot of different options out there. And that sums up all that I have here for my presentation. So does anyone have any questions?
Christina, it was really well done. I think that so thorough explains quite a bit about pharmacy, not only your role, but other possible roles too. I found something interesting that you said, and that's for future students that are thinking about pharmacy. And you said you kind of did some investigation on your own. If I remember correctly, and it was a while ago already, but you did some work with a pharmacist, did you not? Did you do some, like, a job shadow or spend some time with a pharmacist?
I did, yeah. So yeah, when I was in high school looking at different career options, and that was at the time when I did think that pharmacy would be kind of boring, because I did think that all they did was count pills. But I was able to actually job shadow with a pharmacist in my hometown, and I got to see a bunch of different things that she did. I know I can still remember her and I sitting down with a patient, and this patient was looking to quit smoking. So there was this booklet that she had, and she went over step by step. We came up with a plan on how this individual was going to quit smoking and what their plan was with that. And it was basically like a counseling session that I didn't even know that pharmacists did. And I just got to see a bunch of different aspects of pharmacy that I didn't really know were possible. So that was really interesting. I know now, I think the guidelines have changed a little bit with how we are allowed to job shadow students. I know for confidentiality reasons, I don't know if we're allowed to bring in high school students to pharmacies now to job shadow. I don't know that for sure, but I know there has been some changes recently, just with respect to confidentiality reasons.
Even having some of those discussions just with the pharmacist without the patient, would that be a valuable thing for a student to do? Like,
Yeah, I think so. I mean, asking any pharmacist kind of what they do on a day-to-day basis, what are their roles that maybe aren't traditional roles. If anyone ever does have questions, I mean, just reaching out to someone in that career and in that role. Maybe someone wants to know more about what a pharmacist does in a hospital. And the best thing to do would be reaching out to someone that actually does that role every day, because they would definitely be willing to help out with that.
Yeah, no, I think that's what I wanted to find out from you. I thought you had done something like that, and I think that's a valuable process. I think for students to kind of consider is go to the source. Somebody like a career counselor like myself. I was a career counselor. I was a teacher. I didn't know much about pharmacy other than what I could look up. But so taking that initiative and making contact with somebody in the field, I think that's a great idea.
Mm-hmm. Yeah.
Any other questions out there?
I have a question about the company itself, the Rubicon. How many employees do you employ, and what are the prospects of a new pharmacy student getting on with a company like Rubicon?
So Rubicon actually has a bunch of stores throughout Western Canada. So a lot of Pharmacies are actually owned by Rubicon. Some Pharma Choices are owned by Rubicon. A lot of times people maybe aren't aware that it's a Rubicon store, but they do own quite a few pharmacies. The pharmacy I work at, it is called Rubicon Health Solutions. So like I said, it isn't a traditional pharmacy. So Rubicon as a whole, they would employ a lot of pharmacists throughout Canada. For our specific store, we do have the central fill side of things. So I did mention the technology that we have in the back of the pharmacy that packages medications. So we actually package medications to a bunch of Rubicon pharmacies throughout the province, and these would be distributed to patients at those pharmacies. So we do have a lot of people employed in the back, working with technology. These are more pharmacy assistants, not necessarily pharmacists. But up in the front side of things, where the pharmacists work, we have, there's, I think, 6 pharmacists now. We have 2 registered pharmacy technicians, and we have a couple pharmacy assistants as well. So my best advice for someone looking to kind of get in with a company would be, in university, getting involved and going to career fairs. I even remember when I was in university, there was always, lunch and learns. Companies were coming to present on their company. I even remember Rubicon coming and sharing a presentation about the company and kind of opportunities within the company. A lot of pharmacy companies will do this to students. A lot of times there will be career fairs. So my advice would be to get involved and to meet people. Pharmacy really is quite a small world. So a lot of times it's developing those relationships with people, and just getting to know people. You don't know how that might affect you later on down the road in your career, and someone maybe you met back in university might be able to help you get a job in the future.
Awesome. Thank you so much for that.
Christina, I know it's pretty competitive to get into pharmacy, and once you're in, the course load is fairly intense. Can you speak to that a little bit?
Yeah, it is quite competitive to get into, and I know they have changed the application process a little bit since I was in pharmacy. But they do take the application process, they do take your marks. I think you need at least a 70% average of university level studies. And then there is a situational judgment test. I think it's an online, like an online exam type thing now. This is a little bit different than when I got accepted. And I also think there's a personal video interview that you have to do now as well. But it isn't just all marks. So I think the marks are maybe 60%. And then for myself, when I got accepted, it was 30% a critical thinking essay and 10% a personal interview. So yeah, I would say it is competitive. So definitely making sure that you are keeping up good marks, but also being involved in other things too helps you out. As for the workload, once you're in pharmacy, it is quite a heavy workload. There's a lot of labs that you have to do. It's very long days, but it's very rewarding, and you get to do a lot of extra things too. In this picture here on the slide, that's me and my friend Kelsey. We set up in the health sciences building at the university, just a little presentation on OTC analgesics. So things like Advil and Tylenol, and you get to do little extra things to stay involved with the college and to promote your profession. And when I was in school, I think we had a class of 90, which I believe is still the same. And you really get to know those people very well throughout your 4 years of schooling. You see these people every day, all day. So I met some of my closest friends in university who are still my close friends today. You get to develop those relationships with people who are going through the same thing as you. There was definitely stressful days and stressful studying times, but being able to know that you're doing that with other people, and there's always people there if you need help. There's your professors you get to know on a personal level. They're always willing to help. there's definitely, I would say my 4 years of schooling, it was challenging, but it was very rewarding, and part of me does kind of miss it, actually.
Christina, just another question about that. So, you know, some people go in with the target of becoming a pharmacist, and it doesn't kind of work out for them. They just, you know, they maybe are just fall a little short of the standards. Are there some other, you know, you may have known some people like that. So what are some other related areas, you know, of you know, related to pharmacy or related to some of their pre-university courses, you know, would kind of meet, you know, some of their requirements as well?
Yeah, so a lot of the pre-requirements are like biologies, chemistries, those science classes. So I know even when I was doing my pre-pharmacy classes, I did get to meet some people that also were wanting to become pharmacists, but instead they decided to maybe choose different career options. I know some people that went into nursing after. There were also some people that were in my pharmacy class that actually left pharmacy to go into medicine. You know, there's a bunch of different options, I would say, in the healthcare field that would be similar prerequisite classes, I guess.
Okay, thanks. Are there any other questions? Questions? If not, then Christina, well done. Thank you very, very much. Keep up the good work, and hopefully we'll see you back home someday. Okay.
Yes.
Take care. Okay.
Thank you.
Bye.